Well, hello everyone and welcome back to my channel. In today's video, I am going to be talking about how to understand the themes in the situational judgment questions in the MSRA exam. So if you don't know, I'm an anesthetic trainee who had to get extremely high scores in the MSRA so that I was eligible for the interview. And I found the MSRA to be a bit weird kind of an exam, and therefore I have made a few videos in regards to that. I will be linking all of the videos down below if you are interested to find out what the MSRA is, what are the resources that are available, and what are my thoughts about those and how to prepare for the exam. But for today's video, I wanted to focus on the SJTs, which is the situational judgment part of the MSRA exam, because I myself found it a bit challenging at times. And here are my tips that, in my opinion, help understand these SJT questions a bit better and hopefully get you a higher score. So I'm going to be talking about recognizing the themes. I know that sounds like a weird sort of a video, how to recognize themes. I'm sure you would be aware that there are themes in the question, like in any scenario, which is non-clinical. But for me, that was something that I struggled with. I didn't understand the concept of recognizing a theme, and at times I found that there were multiple themes and I got confused which theme I should go for, and so on and so forth. So before we get into the themes, I want to tell you that these themes actually come from the GMC guidelines of good practice. And if you've read it or if you're aware of it, then you maybe not need to watch this video. But if you haven't read the GMC guidelines on good practice, or you're not really well versed with it, or you want just a refresher, then hopefully this video would be able to help you. I'm not going to talk about every single practice guideline from GMC. I'm going to be doing specific exam related themes in today's video. Before we begin, you should stop thinking in a clinical manner, which is something that I absolutely struggled with. I always thought about something clinical, and obviously that is not the way to go for situational judgment exams. So once you have switched off your brain and you are ready to attempt the situational judgment questions, your job is to recognize the theme. One of the common ones that comes is consent. So if you are somebody, so remember about consent is that if it's a surgical procedure, you can't take consent if you're not the surgeon. I know that sometimes that's not the case in real life. So when you're taking the situational judgment exams, you have to be very by the book. So if you're an F2 in the scenario, or you're a CT1 or whatever, and are unaware of how the surgery is going to be done, then you cannot consent to the patient. Make sure that you don't make the mistake, which most of us do, and thinking that that's the correct option, which it isn't. You can't. Another theme that comes a lot in the exam is confidentiality, which I think that most of us don't really register that well. And I don't think that we actually go by the book when we talk about confidentiality. Confidentiality it's implied by the patients and we go with it, and they don't mind. But in the actual questions, if confidentiality comes, then you have to be very, very careful in answering those questions. And as you know, SJTs is a ranking thing. And as you know that SJTs is a ranking system, make sure that you rank the one that is most appropriate in terms of confidentiality, and not do what you think is right, which it probably isn't. The next theme that comes a lot is patient safety, and I cannot stress enough on this one. If patient safety is part of the question, and there might be questions where there are several themes from the good medical practice in a question, but if patient safety is a part of the question, that my friend is your top priority. You don't need to rank anything else higher. The patient safety is the one that you need to think about the first, and then anything else comes into play. I have mentioned this before in past videos as well. Even if confidentiality is part of the theme and patient safety as well, then patient safety supersedes confidentiality. I know, quite bizarre, but there are several questions that come in this kind of a theme pattern, and I just thought that you guys should be aware of it. Next up is professionalism, which comes a lot as well. I personally have a very weird relationship with professionalism questions, because part of me would obviously want to ignore whatever is happening. That is my introverted personality. Like, don't try to engage in other people's business, unless obviously patient safety is a part of the theme. But an example question would be, say for example, and I've talked about this previously as well, but I just can't get that question out of my head, is you're in a GP practice and you open a door and you see two colleagues, one is a nurse, one is a doctor, and they are making out, and the next questions in the exam basically are, what are your next actions? And my mind, as I've said several times before as well, is astaghfirullah, oh my god, and then just running away. But that's not how you're supposed to answer those questions. So when professionalism comes into play, the questions in the MSRA, they want you to kind of act in a analytical manner and not think about your personality as per se, but actually think about the repercussions that the actions could take. So for example, in this situation, they wanted me to actually go and tell a senior and inform somebody like above me to, I don't know, tell about this. And there were other bizarre options as well, like tell the partners, because apparently those two people were not married to each other, but they were married to two different people, which I don't know why is it part of the question. I don't know, but it was. And these are example questions, by the way, and I was just shocked reading the question. But however, cut to the chase. So professionalism means that you are going to raise this properly with the correct channels, and you're going to inform somebody above you, and you're going to tell those people off as well. So these would be the correct options. Ignoring is not the case. Why? Because a patient could have been, you know, opening that door and seeing this. So in my opinion, patient safety is not concerned here, but according to GMC guidelines, that's against professionalism, and it is part of patient safety, and therefore we should be dealing it with said way that I just told you. Another one is acting with integrity, which I think comes same with professionalism, but apparently integrity and professionalism, two different things. An example would be a consultant comes in drunk, and you're it, and that's it. So what do you do next? So you have to raise it appropriately, and you have to send that person home, and you have to be honest about it. So professionalism would be you obviously raising things and escalating and all of that stuff. But integrity is if there's an investigation and you're asked to come and talk about it, then you kind of have to. You can't avoid it. So if that kind of a theme isn't there, then you have to act with integrity, which, as I said, I want to ignore things and move on, but the MSRA doesn't want that. Similar scenario comes for maintaining trust with patients, maintaining good colleagueship with colleagues, like stuff like that, which I think it's pretty straightforward as a theme, and I don't think I need to delve more into talking about it, and I want to keep the video short. Another thing that comes a lot is confronting colleagues, and I've talked about the drunk ones, not like that. It's the like somebody coming in late, somebody having a different like behavior than normal, and obviously the first thing is to talk to the person, talk to the like in person, like those kind of things. Don't go too rash, don't go and make weird horrible sorts of actions. So kind of like mellow sort of a thing. That's a theme that comes. I think it's quite easy. I don't think I need to explain further about this as well. Surprisingly, there's a lot of relationshipy kind of questions that come in the MSRA exam. I'm not sure if you're prepping for it. Have you come across such weird questions? But the pools that I was doing were filled with these kind of questions, and quite bizarre. I actually was really worried about why is that so much in detail. But say for example, there's a big theme about what rank you are and what rank your partner is, or girlfriend or boyfriend, whatever. So if you're a doctor, you can't date a medical student. If you're a consultant, then you can't, like, you know, the hierarchy type of questions, they come a lot, and they're pretty straightforward as well. So that's a theme that comes up, and I don't want to talk about it that much, to be honest. There's another that comes about x-rays and imagings and things like that. And I found out apparently that we are allowed to use x-rays and CT images and stuff like that without consenting the patient, if their name and their whatever is not part of the picture, or not part of the abstract, or not part of the poster. That's something I found out like while reading GMC, which I thought is not, like, we're not allowed to, we have to ask for pictures, but apparently not. According to GMC, if there is an anonymized like picture which tells nothing about the patient, age, gender, age, like nothing, just the picture for pathology, then you can actually use it and you don't need to consent for that. Just something that I wanted you guys to know. Another thing that comes a lot is doctors using social media and doctors in public space as well. Two very different but similar kind of concepts. So there were questions regarding, like, for example, there were questions like, you're in a party and you've like drunk 1 glass of beer and then somebody arrests in front of you, what you do? And obviously, because you've done all the patient safety and all the drug related questions and stuff, your mind normally goes like, no, okay, I'm drunk, I can't do this. For somebody who doesn't drink, which is me, I had no idea of how much 1 glass of beer can make you feel like. But obviously I thought that, no, I mean, you can't, because I have drunk alcohol. But apparently not. There's a Good Samaritan rule, and if you see somebody on the road, if they start choking or seizing or, I don't know, have a cardiac arrest, then you are first on spot and you can act as a Good Samaritan and not as a doctor. So even if you have drunk a little bit, you can go and attend to that situation. But if you are in public and you're like dressed up as a doctor and you are not in your senses, then it's best not to engage. And also, you are not allowed to, which I'm sure you know, but you're not supposed to give advice, medical advice on social media and things like that. I mean, so yeah, be careful in real life as well. Those are not the things that you would like to do. Yeah. Also, conflicts of interest is also a topic that comes up a lot. I personally did not understand most of it, but because, again, most of it was relationship based and it's just too confusing for me. Also uncomfortable. The MSRA questions made me feel very uncomfortable. But so there are questions like, you're a doctor and somebody asks you for your number, you politely say no, or you're a doctor and somebody gave you a box of chocolates. So the GMC guidelines, and you should definitely confirm this, but I think there's a cutoff for pounds, so it's like £100. Anything under £100 as a gift you can accept, but nothing precious or those kind of things you shouldn't accept. So a box of chocolates is fine, but direct up money is not, and anything else is also not. So you can't, it creates a conflict of interest apparently. And also, if you are the doctor and the person is trying to, and you're still their doctor. So my question to my registrars, who I discussed these weird, bizarre scenarios with and themes with, were that, like, so for example, if you meet someone and you don't know that they're part of your GP surgery, or what if they come to the hospital and you are in the, like, you know, those kind of scenarios are there. And so basically what you have to do is declare the fact that you are in a relationship, or in, what was the word that they taught me? Courtship. So you're courting this person, and so basically, yeah, I mean, if you are in that kind of situation and the person comes up, then you can't be their doctor. You have to declare it. It's part of professionalism, it's part of integrity, it's part of duty of candor. It's part of so many things apparently. So if you are in a relationship with somebody who ends up being in your GP surgery, or who ends up being in your A&E, or you just found out, then you have to declare it to GMC. That sort of a thing is also part of the theme. So yeah, I mean, these are the themes, the most common themes that I found were part of the SJT questions from the Good Medical Practice. This is all from GMC. You can go and read it all yourself, or you can read the Oxford book, which I talk about in length in one of my videos. I'll link that video above in the cards. I hope that helps you out. I mean, it was funny when I was doing the SJTs, and to anybody who's struggling, I really feel for you guys. I am so glad that I don't have to take the exam again, because it was just bizarre and I still can't understand most of it. But I hope that this video helps you out. If it does, give the video a huge thumbs up and subscribe to my channel if you haven't already. And also, please list down below any other themes or tips you've found that help you taking these questions. because people read it and people ask me, and if you found this video, then your comments will help them as well. So hopefully you guys have a good day, and I will see you guys in the next video. Bye.